This episode of Futures Fast Forward is brought to you by our friends at Miller Welding and Machine Company. Founded in 1963, Miller Welding and Machine Company of Brookville, Pennsylvania is a single-source solution encompassing fabrication, machining, and finishing technologies aimed to meet the wide range of needs that our customers demand. Staffed with a team of engineers and highly skilled employees, our quality and our commitment make us a leader in this industry. We provide our customers with high-quality parts by continually improving the processes we use, and we provide our employees a safe and satisfying work environment and invest in their futures by constantly investing in new technologies. 2 readily accessible state-of-the-art facilities accommodate our workforce of over 300 highly skilled employees. For current news and employment opportunities, visit our website at www.millerwelding.com. Working in a hospital, when you think of a career in pharmacy, I preface this with saying this is a very different world than your local drugstore.
Correct.
Okay. What are the most significant differences between the retail drugstore world and pharmacy that way, and pharmacy as it's practiced in a hospital?
Retail setting is a doctor giving a patient a prescription who comes into you in a retail setting and gets that prescription filled, and you take that medicine home. Here at the hospital setting, you're dealing with why they're in the hospital, what reason they're here for. You're treating that process disease that they have at the time. So how it works is the physician comes in, writes orders for what the patient may need medication-wise. That order is then sent to the pharmacy by fax machine. That's how we work ours right now. The pharmacists enter the medication that's ordered into the computer system. Everything's computerized here. We have labels that then are generated from the order that the physician is, wanting. The technicians pick the medication. That's how they work with the pharmacists. The pharmacists enter the orders into the system. The technicians pick the medication, and then the pharmacist double checks what the technician has picked for that specific patient.
Director of Clinical Ancillaries, Luke from Kane Community Hospital. He actually says that means pharmacist. So we're here to find out exactly what the day in the life is like for Luke Gilmore and being the pharmacist for a hospital.
Basically, you have to be interested in math and science, helping people. I started looking at it when I was in 8th grade and just followed it up through high school, and kept looking at classes that I needed to take throughout my high school career, and it just kind of flowed.
8th grade?
Yep.
That's an unusual. I want to be a pharmacist. Usually, you want to be a baseball player. Tell us about that. How did that come about for you?
We had a career education class, and we had to go down through and list what we like to do, and they would give us different fields that they thought would be good for us, and one of mine was pharmacy. So I really didn't know too much about it, except you go to your local drugstore to get a prescription. So I decided to look into it, and I just kept following it from there, and here I am.
Tell us a little bit about the difference between what you do and what your neighborhood drugstore pharmacist does.
Here, it's a little more clinical. It's nice because we have access to the patient record, we have access to the physician, so we can talk to the doctors, kind of see where they're trying to go, and make recommendations at the point of care. Whereas being out in the retail world, you still can kind of do that, but not really. It's more patient education focused, whereas here it's provider education. We still definitely do patient education, but we try and basically look what's going on with the patient while they're here, look to see what makes clinical sense, and make recommendations.
Now, the difference is the patient himself in retail is bringing you that script. Here, we don't necessarily see that patient. It's sent, the order is sent from the physician to us in the pharmacy, and then we deliver the medication to the floor where the patient's at. So it's a little bit of a clinical difference compared to the retail side. You're dealing more with the disease state on this side. Again, you have to be a licensed practical nurse or a certified tech to work in this pharmacy.
Which in retail, you don't.
Correct.
Okay.
Correct.
That's
now there's 2 different levels. You can be a certified pharm tech, and then you can be just a regular pharm tech also.
Do you tell me what level of medication you're dealing with here. Do you deal at all with oncology, or do you?
We don't do oncology here.
Okay. How is that done here?
They do go basically to an outpatient center like Warren General or DRMC. Okay. We used to do mixed chemo, but mixing chemo you'd probably need a full-time pharmacist for that and an oncologist, and Kane doesn't currently have an oncologist, so.
Chemotherapy, because it is such a toxic agent, is checked by 2 pharmacists. So when we receive a chemotherapy order, we copy that order, and 2 pharmacists independently check all the calculations, concentrations of the drug. We prime the IV bags before we put the chemotherapeutic agent in the IV bag, so when the nurse is delivering the medication to the patient and the nurse are less likely to come in contact with the chemotherapeutic agent, because some agents can be toxic to the skin. When we actually mix the chemotherapeutic agent, we will glove, gown, and mask. In addition to that, the hood has a glass shield that prevents us from spray back. So we would get the drug ready to add to the bag, and when we have that all done, we would draw up the amount of drug we're going to add to that bag, have a second pharmacist come in and check that solution, and then inject it and take it to the patient.
Basic job as a tech.
Hustle and bustle, that's what it is.
Yes, it's very, very busy.
Yeah, it is.
Very structured. The orders come through in our fax machine. The pharmacists enter them on the computer, so everything they enter then comes out on a generated label. Over here, give you a good idea. The orders come out here in the labels. The technicians get them here, pick the medications through various areas throughout the hospital, whether it's a medication, an ointment, an IV. The technicians go and pick the medications, bring them over here to what we consider our pick table, so the pharmacist can then come and verify what we do. It's very, very busy. We make runs throughout the hospital every hour on the hour, so it's very busy.
So this pace that we're seeing happening here, is this 24/7 like this?
We're a 24-hour pharmacy. Yes, it's very busy.
And there are always this many people in here?
Night shift, there's a few, not quite as many, but during the day, yes, this is what you're going to see.
Wow. So you see, you thought you were going to get involved in pharmacy and be able just to snooze and watch the ball game while you're at work.
It's
Not
very
here.
busy.
Very, I would imagine very intense too. I mean, you're dealing with things got to happen. You're out there trying to save people's lives.
You have orders, you have routine orders, you have a variety of things that you're picking medications for, sending to the floors. It depends on what the patient's condition is at that time.
Day in the life. I get here between roughly around 6:30 in the morning. We have a fax machine there that they fax all of the orders.
Look,
And here one comes. On cue.
Yeah, exactly. Unbelievable.
We have nursing order entry. The nurses enter the orders, especially when we're not here. The pharmacy here is only staffed 8 hours a day, Monday through Friday. And then I'm on call all the rest of the time. I'll check the orders in the computer, check the patient's medication administration records to make sure that they're correct. Then we get a daily fill sheet from our Pyxis machines, which are automated dispensing machines. We kind of fill those. The computer systems talk. It tells the nurse, all right, we'll pull up this patient. These are the drugs that are on. The nurse will select the drugs they want to give, and a drawer will pop out. These are our automated dispensing systems. You log in. Fingerprint identification for security.
Biometrics?
Yes. Latest and greatest. You pull up the patient's profile, you select what you want to give, hit remove, and a drawer will pop open. This tells you it's in drawer 12, which is this drawer. Pocket 14, you got a pocket 14. And
This did this for you automatically?
yep. It works with our current computer system. It'll take the profile of the patient's medications on what we have them on in-house. It transmits it to the med station. The nurse selects what medication they want to give, and the drawer will pop open and tell you where to take it from.
These are the medications. All the patients, whenever they're registered through the hospital into the emergency department, the their name comes up into the medication system, and we can access any medication we need through this machine. We also have another machine for our cardiac meds and our narcotics in a separate room.
Now what are these ladies doing over here?
I'll show you.
Okay. Futures Fast Forward is sponsored in part by United Electric Cooperative. United Electric is special because it's owned by its members and is guided by a set of principles that reflect the best interest of those members. United Electric Cooperative members reside within 10 counties in PA, and the cooperative operates an electrical system that spans 7,000 square miles while employing 72 local people. United Electric Cooperative, owned by those we serve. Visit our website for updated job opportunities. Jefferson County, Pennsylvania is open for business with excellent tax-free building sites, a talented and experienced workforce, and business services specialized for your development needs. Jefferson County Department of Economic Development is ready to help you and your company grow and prosper. Join other prosperous companies such as Miller Welding and Brookville Equipment that have made Jefferson County their home. For more information, contact the Jefferson County Department of Development.
This label printer is for IV medications. Over in the other area was for medications by mouth. Over here we have suspensions that Karen King is drawing up right now. So this is our liquid section where we dispense to our patients. A pneumatic tube system, very handy in the pharmacy. It goes to all the floors. It's very clean. We have a medication that needs to go directly, like right now a statin medication. Just like a bank machine.
Just like a bank, that's what I was going to say.
The tube
Very
comes
cool.
down, we send it to the floor. It's a very new automated, operation. It's very nice for the pharmacy and the rest of the
Now,
hospital.
Suzanne, for you, on the clinical side of things, what a much more extensive education, I would imagine. Tell us a little bit about what does it take to break into this industry from your standpoint.
Basically, right now, the pharmacy is a 6-year program. It used to be a 5-year program with a 2-year PharmD. Now it's a 6-year program across the board, and there are certain schools that have a 2-year pre-pharmacy, and then you have to either take the what's called PCATS pharmacy boards to get into pharmacy school and get accepted, or you go through a 0-6 program where you go all 6 years at the same school and you don't have to test into it. When you come out, you can get a job just as a pharmacist at that point, or they have residencies and fellowships. Residencies are, in the very near future, going to be a 2-year program. It's called a PGY1 and a PGY2. And the first year is general overview of pharmacists and going out on the floors and working with the patients and the physicians. In the second year, they will specialize into, for example, infectious disease and nephrology. Then they can follow that up with more residencies or fellowships which further specialize them, similar to what the medical field does.
There's 2 different levels. You can be a certified pharm tech, and then you can be just a regular pharm tech also. Now your certification is going to get you more. It's going to get you a little bit more money. It's going to get you a little bit more job opportunities out there than if you're not certified. That is the basic education you need to get your foot in the door.
4-year, what's it?
The LPN is an 18-month program. The vocational schools usually have that program. Jeff Tech, Clearfield Votech is where you get those programs locally. Now, Mount Aloysius does have a Pharm Tech program where you can go there and you can get, I believe it's like an associate degree that you can get through there. But other than that, close-wise, I don't know of any more.
The other, not degree, but certification that pharmacy is moving toward is board certification, which is Board of Pharmaceutical Specialties, and they have them in different fields. For example, nutrition pharmacy, nuclear pharmacy, pharmacotherapy, which is very general, like internal medicine. And so that's your background, and depending on if you want to go to an institution or if you want to go into research, that will determine how far you need to go.
Is there a special certification or schooling that's necessary to work with chemo, or is this something that you gain on the job?
When you're in pharmacy school, the program is now a 6-year degree, and you come out with a doctorate of pharmacy degree. With that training, you can be trained at a hospital to mix chemotherapy. You can also get a certification in chemotherapy admixture. Each pharmacist is required to get 30 CE credits per 2 years to get relicensed.
What sort of commitment by way of education and did it take to achieve this position?
It's a 6-year road. Basically, it all depends on what school you go to. Actually, some schools are 8 years. Some schools of pharmacy require you have a 4-year bachelor's degree before they'll accept you into pharmacy school. Others that have pharmacy programs, you'll do 2 years of pre-pharmacy. Some you then have to apply to pharmacy school. Others, as long as you keep good grades and a good academic record, will accept you into their pharmacy school, and that's 4 years. So it's 6 years total.
What about wage scales for this type of work?
I think that it varies, but generally I believe they start between $35 and $40 as a base, and then based on years of experience and tenure at the institution.
And I understand locales are different, hospitals are different, but industry-wide, what are the averages for starting in, and even more advanced salaries? What can somebody make doing something like this?
Sure. Right here, a starting wage is right around $12, give or take a little bit with your experience.
Okay.
So that's an entry level. Now again, your experience is going to get you a little more, and then what you do with that is going to give you a little bit more too.
Okay. And I think that colleges are a little bit lower, but that's what the hospital pays, and then retail pharmacy is higher than hospital in general.
Contamination. Everybody's always so afraid that you're going to catch something from working in the lab.
Doesn't work that way?
No, not if you're careful.
That's okay, because they're teenagers. Imagine what their rooms are like. Yeah. We're here with Tina and Mary Jane at Kane Community Hospital to find out about careers as a medical technologist. Now, there's all sorts of labels in these career fields we're finding, and variety of different degrees of education and job specialties. What exactly does it mean to be a medical technologist?
I'm actually a medical laboratory technician, which I have a 2-year degree. And we basically took science courses, math courses, and then we learned how to work in a laboratory. We took time to actually work in a laboratory and learn how to do the field.
And as far as the technologist, you're an actual technologist. Now, the difference would be what?
It's an extra two to sometimes 3 years of school, and it's a little bit more intense. But we learn basically the same concepts. We just go a little bit more in depth.
So what's the end application for what's a day in your life like as opposed to a day?
They're the same.
Working here, they're the same. We both do the same work. We have the same jobs, responsibilities.
Really?
And no matter, this is my 4th hospital, and no matter where you go, they teach you the way they want you to do the work each place.
I mean, you're the folks that are actually running the test when a doctor orders a particular blood screen or something like that. You guys are...
Right, when the doctor has an order, we come into work in the morning, we know what he wants done on inpatients or outpatients. We go to the floor, and we actually draw the blood too, along with the phlebotomist.
Are the pay scales the same? I mean,
No.
Okay, so the pay scales are different, but you're doing the same thing.
Advancement opportunities, I think, are different.
Okay, like
we become a manager.
Yeah, we found that in, I can't remember what the other fields were. I think imaging, some of the technologists as opposed to the technicians, as a technologist, then they can move into management, buying, all that kind of stuff.
And I think the difference is, like, you have to have that background to know what's normal, what normal ranges are, what's critical, what to look for, and
how to troubleshoot.
We work with instruments.
Really?
Yeah, that's a big
just
thing
like
now.
having a computer. You have to have a little bit of background on how it works so that when something goes wrong, you can get it fixed.
And continually keep up on the new technologies, I would imagine,
that's what
too.
was hard for me, because I stayed home with children for a while and came back to work. And we did a lot of things manually years ago. Did you do manual?
We had to learn how to do it in school.
What is the most challenging and fascinating, interesting aspect of what you do?
Oh my.
Dealing with the doctors, huh?
No, 2 days are the same. Ever. Right,
yeah.
Ever.
You don't ever know what's going to go on when you walk in the door.
That's right. You could have a day where it's very slow and you spend a lot of time doing reading, paperwork, continuing education, or you could have a day where you don't sit down. You're constantly on the move. patient after patient after patient.
So it's a very high stress job.
Really? So there's a lot of pressure. You got to get it right.
has
There's
to
no
be right.
real margin
no
for
room-
error, is
No
there?
room for error.
Interesting. How do you? That's really interesting. You know, I mean, I know how I deal with my stress. How do you deal with that stress of, you know, you're making that life and death decision there? Really, it could be.
You just have to trust I think your instincts first.
Plus your peers,
your peers.
Here's the people you're working with. We do a lot of consulting
Yes,
with
we
each
do.
other.
A lot of teamwork, a lot of
Yeah.
second opinions.
And with the pathologist, we consult if there's a real problem.
With the doctors, with the nurses, it is a very team-oriented job.
What are some of the myths that you know that come with your job about?
You have the best
Tell me.
Yeah.
What is it?
Well, when I was in school and training, I couldn't draw blood very well, and they said, "Oh, you'll never have to do that. They have phlebotomists that do that." Well, everywhere I've worked Du Bois, St. Mary's, Ridgeway, and we draw blood on a
Every
daily
day.
basis every day,
Oh my.
and we don't mind.
Not
You
at
know,
all.
We like the patient contact.
Yeah.
Actually, well, we do. Not everybody does, but.
Now you were telling us about the myth of you know, the stupid little joke that I made about you being infected, glowing,
No,
and biohazardous material.
No, it's
We do have biohazard
We do.
material, but we put it in biohazard bags.
But you protect yourself. You're responsible for protecting yourself. You gotta wear your lab coat.
We wear
and
gloves all the
gloves, face mask. You handle every sample as if it's
Contagious
biohazard,
too.
because it is, as if it's contagious. I don't know of anybody that's ever developed an illness from direct patient contact or
I don't
direct
either.
sample contact.
Excuse me, sir.
As he's coughing in here.
Yeah, I came in here with an illness. I'm the biohazard, you see. A walking germ factory. Futures Fast Forward is brought to you in part by Du Bois Business College, providing quality post-secondary education for over a century. Their commitment is to develop programs that enable their graduates to be successful in their field of study. And they work closely with businesses and set programs that correctly mirror current industry trends and the modern use of technology. With 3 campuses in central Pennsylvania, Du Bois Business College can help you touch your future faster. Visit them on the web at dbcollege.com.
Our look at careers in healthcare continues as we delve into the world of anesthesia, one of the most in-demand medical career specialties. What does it take to put a patient to sleep and bring them back to consciousness again?
This is where it happens.
Most hospitals use a team approach where you have anesthesiologists and nurse anesthetists. The anesthesiologist is the MD that goes through regular medical school. He's a physician. He then specializes in anesthesia, and he usually runs the department. The CRNA, Certified Registered Nurse Anesthetist, is a professional that went through nursing school, then afterwards went to a specialized anesthesia school and comes out with a master's in anesthesia, but practices on their RN license. So the anesthesiologist practices on their medical license. We practice on our RN license. So they say anybody can put a patient to sleep, but to wake them up is the key part. So then you got to wake them up and you got to do timing. What you have to do is you take on all the responsibility and care of that patient, and it's a pretty awesome responsibility because their life is in your hands. So you want to make sure that every patient comes out in excellent shape. And what we are, we're like the worker bees. We're the ones that get in there. We're assigned to all the operating rooms. We give the anesthesia in each operating room. Let somebody kind of hook some of these things up to you so you can see some of the equipment we use. You want to be a volunteer and sit down?
He doesn't need any help falling asleep. We already talked about this.
So we'll put a blood pressure cuff on you. This goes on every patient that comes in. So if you were a patient and you were going to have surgery, we're going to hook this up to you first. I hope your chest isn't too hairy. We're going to hook this EKG monitor on. So we watch your heart the whole time you're asleep. Some people say we're like guardian angels. We watch over you and take care of you while we let everybody else do the work. But really, we're working at it constantly. And we have more monitors that we put on. This is called pulse oximetry, and we put this on and it tells us the saturation of oxygen in the blood. And what we're doing here is we're going to take your blood pressure, we're going to fire this thing up. Everything is touch tone screens on us. And right now we can see you have a normal sinus rhythm. You have a P and a QRS and a T wave. That's normal. And it's running 63 beats a minute, 64 beats a minute, which is excellent good health. We're going to take your blood pressure now. You can see what that is. This one here is checking your saturation of your blood, the oxygen in your blood, and it's showing that you're 97% saturated, 98, so that's excellent. If you were a smoker, that would probably be lower. Here's your blood pressure came up. You have a systolic of 117 and a diastolic of 86. So that's good. The diastolic's a little high. We would prefer that under 80. Systolic's good at 117. The diastolic is how much your arteries and veins relax, okay? And what we find is you're a little bit tense. Now either you had coffee or maybe you didn't eat yet. There's some reason, but you're a little tense. Right, this is the typical anesthesia machine. We have one of these in every single operating room. And what it does is it lets us use a combination of gases, which we use in here. We call them vapors because they're liquids and then they turn to gases. And then on these IV poles, which I don't have any medicines right now, but we administer the medications to the patient, and that'll put them to sleep. We have our major drugs that we put patients to sleep with, and Pentothal is the most famous, that most people are used to.
Right.
But we use a new type called Diprovan, which is more of a synthetic type medication. It's based on a soy-based medication. And these go in the mouth to protect the airway so that you're breathing well, because once you're asleep, your tongue can get in the way. So these are the airways that we use, and they just fit in like this.
I could use one of those. I could use a bunch of those at school, man.
It'll keep you quiet. So then you would be sound asleep, you wouldn't know, and probably what we would do is tape your eyes closed. And the reason we tape patients' eyes closed is because it keeps them moist. If we don't tape your eyes closed, your eyes would dry out. You'd start breathing, we would monitor that. If we needed to take over for you, we would shut off this pop-off valve, and we can breathe for you. I could breathe for you and give you oxygen. Okay? So once you start waking up, I'd say, what's your name?
Justin.
Justin. I'd say, Justin, do you hear me? You'd say, yeah. I say, how you feeling? Okay. Turn everything off, take this off, and then they'd bring in the cart, and then we would wheel you to recovery room. Schooling, nursing school is usually a BS program, so you get 4 years in a BS in nursing, and then you would go on to anesthesia school, which is 3 years in a specialized anesthesia program. Throughout the United States they are, and that's about a 3-year program right now, and you come out with a master's, and then you have to take boards in anesthesia and be board certified. Another thing that's nice about it is a field that is very needed. There is very few anesthetists around, even though they're in every hospital, so we have quite a shortage right now.